Okay then, because we can get started for now. Amy, Jack, Christian, thank you for joining this first Health Innovator Info session. Now, you can see the presentation in your screens, right? It should be a Health Innovator.
Yes, I can see it.
Great, awesome, thank you. Okay, first of all, let me introduce myself. I'm Alberto Ponce. I'm the Innovation Center Coordinator at the Medical Center of the Americas Foundation. The Medical Center of the Americas is a nonprofit that seeks to create economic development through elevating the life sciences ecosystem in the Paso Norte region. This meaning El Paso, Las Cruces, Ciudad Juarez, the whole border region. The Innovation Center, it's the programmatic side of the MCA. We do business development. We focus on startups, entrepreneurs, small businesses. We have different programs oriented to creating this support in the community. Now, what we're going to be reviewing today is the Health Innovator Program. This is the second cohort or the second version of a program that started last year. And I'll be getting into right now. But the Health Innovator Program, it's an accelerator that's binational, and it seeks to empower healthcare professionals to have their experiences, their day-to-day ideas, and leverage them to create a prototype medical device that could actually flourish into an actual product, an actual business. So this is focused, again, for healthcare professionals that in their environment, in their day-to-day, they encounter many issues, many ideas, and to take that outside of their medical, their healthcare environment, and transfer them into a health, an innovation process that will result into a successful product. Now, the Health Innovator is completely online. It's completely free for the participants, and it has several components. First of all, there's an online curriculum that's an online resource, kind of like an online course that's open, that's self-paced. It's completely free. It's online. It has 9 hours of materials and resources and assignments and tests that you can use to learn entrepreneurship skills and innovation skills. The other side of it, of the program, is weekly sessions where we go as a cohort and work through specific milestones, specific key stepping stones in the process to work on that medical device innovation and hit those milestones throughout the whole program, so that we all work as a cohort towards the same end goal. And I'll be talking a little bit more about that later on. And then there's a very specific prototyping aspect. We don't seek just to, like other programs that just develop a business plan. We do seek hands-on experience. We want all the participants to have an intimate knowledge of what they're building, that this product is theirs, that you feel this connection to the research that you've done, to the product that you're developing, and also testing out, building, testing, and such. So that's that in on a high level what the Health Innovator is. Now, how we do it, our philosophy behind this process. First of all, central to the Health Innovator process is the need. A good medical device innovation and a good digital health innovation, it's always going to begin with a need, a compelling need. So the process is divided into phases, generally 2 phases. And though I say 2 phases, it's really an iterative process. It kind of makes it's mixed. Sometimes you have to fall back and do more research and have to move around on the process, but it's generally two aspects. The first one is identifying this, as it says there, is to gather a good number of unmet medical needs through observation, and then screen them into a list, screen the list down to a promising few. Now, this, again, from the get-go, most people go to an innovation program, an innovation process with an idea in mind. With, okay, I already know what I want to work with, or I already know a product that I already have an idea. Well, here, even if you already start with an idea with a technology in mind, we are going to still focus on the need. What this means is we're going to try to have the idea for later on. Right now is in the first phase is what's the need? Where is what are the unmet needs on this area? Am I personally interested in? What are my skill sets, into what needs could that skill set go to? If you're specifically inclined into certain areas in industry, or maybe it's a certain population, like it could be an underserved population. That's focusing on the needs. That's the first step towards a compelling innovation. After that, and about half of the program is going to be focused on researching the need. And it's going to be tackling the need from different angles. And you'll see a little bit more about that through the syllabus. Then the second phase is the invent phase, where you take all the needs that you research and all the needs that you've filtered, and the ones that have survived, that have the most promise, the most potential, you devise solutions. And here I need to emphasize plural, because again, most people come in with an idea, a preconceived idea of what they want to do. It's starting backwards. It's once we have the need, we develop several solutions. And it might be that the original idea still is around there, but we want to develop several solutions to one or more of the defined needs using ideation, prototyping, and testing techniques that we will teach you, and filtering based on objective risk criteria. So this is the fun brainstorming part, where we already have a fuzzy goal of what we want to do, what need we want to tackle. We develop several solutions, and the important part here is that there's going to be a filtering out process. The objective risk criteria, it's very important to this process, because you will learn in the medical industry, there's IP strategies, there's regulatory strategies, there's reimbursement strategies, especially there needs, and this is something that most people don't think about in medical device innovation. You need to have focused on insurance and who's the payer and how's that strategy gonna be incorporated into your medical device. And there's also business models to be considered, depending on what medical device, what level of regulation it needs, who is the consumer, who are the stakeholders, who is the provider, et cetera, et cetera. There's so many complexities that need to be considered. And this is why we're giving you the objective best practices on each of those categories, so you can filter out those solutions. Most people will find out that their original idea, their best idea, already has a patent. There's already somebody out there with a patent on exactly what you want to do. But the good news is that most of the time, there's a way to work around patents, to find ways to modify your idea or your technology, your solution, into a way that actually fits with a new patent or a new use model. And that way, yeah, you can have an IP strategy. So that's on a big on a high level what we will be doing on the program. Now, who is the program aimed for? Again, we're focusing on healthcare professionals, but really anybody related to medical devices, healthcare, life sciences could enter. We have professionals who on their own want to generate an impact in their community, in their environment. Last cohort, we had nursing professionals that wanted to develop an app on doing the shift change, information exchange through the different shifts of nurses. So that's a professional that wants to develop their own solutions. This program is also meant for leaders of the healthcare community, for any of the nursing leaders, physician leaders, anybody within a leadership community that wants to problem solve anything within their environment, with their teams. We had last cohort, we had Luis Ochoa, who is the CEO of his company. He's a mechanical engineer, and he wanted to develop a product, and he was championing this idea, and he had a whole team of supporting his idea, but he was the leader, and he was transferring all the knowledge that he gained throughout his team. And also this program is ideal for distributed teams. Last cohort, we had a team of 4 that were completely in different states. One was here in New Mexico and Las Cruces. Another one was in, I think in Minnesota. Another one was in Austin. And we had one team of 4 come into the program, and they were going through the process as a team, but also virtually. So it is very flexible and who can enter and who would gain the most value out of it. Now, as I mentioned before, there's an online platform that I could probably show you. Are you seeing the online platform screen? Should be. Yes. Yes. This is the online platform. You have here more than 9 hours of video content with a bunch of other research material that that you will have access to from the start date of the program. This is all very basic introduction to entrepreneurship, to innovation techniques, to the type of mindset that you really need. So it goes from design thinking, business models, lean startup. This is all just like common terms, common methodologies on the startup community. Have prototyping, technologies, makers, business strategy, formalizing, pitching, practice, all of that. You have all of those lessons here. So that's the online platform. The BioDesign, the curriculum for medical device is based on the BioDesign methodology. This is one of the best methodologies in the world. It comes from Stanford BIODESIGN lab, and they have the best track record of medical device innovation. And the MCA, the Innovation Center, has a copyright license to share their methodology. So you will be getting the best of the best on medical device innovation. That's the curriculum that will be working through the weekly sessions throughout the program. Now, these weekly sessions are basically the only in-person requirement throughout the whole program. These weekly sessions will be around 1 hour of work where it will be divided on a 20-minute, 30-minute presentation on the specific milestones that we are working on that phase, and 30 minutes of work, which is mostly worksheets, mostly peer feedback. This is where we'll take advantage of the cohort, where kind of stepping back, bringing in experts, depending on the phase that we're at, but also a lot of peer feedback on ideation, brainstorming, looking at the different different projects in the cohort. As I said, there's going to be expertise coming in and out throughout the sessions. We have IP consultants, we have entrepreneur consultants, biomedical engineering, mechanical engineering. All of those will be coming in and providing expert mentoring, expert feedback on the projects, on the worksheets and such. And as a result, and let me be very, very clear on this, so you know from the get-go, this is an 18-week program that if you make the calculations starting on September 19th, the program will end mid-January, counting like 1 or 2 weeks from December off. So it is a very intensive program. 18 weeks, it's 4 months, a little bit more than 4 months. So to be honest, in 4 months, there's not much you can do in medical device innovation. So the end result is going to be the best state of a business plan you can make for a medical device without actually investing money into it. So what you'll end up with is a huge binder with all your worksheets, all your interviews, all your surveys, all your research, especially your research into your need. You'll end up with a prototype, a bench tested prototype that you can say, yeah, this technology actually would work. You will end up with a good business plan, business model. You will have a good knowledge on IP strategy and all that I mentioned. This, as an end result, especially for the industry, for the medical device industry, is a great entry ticket to a full-fledged medical incubator anywhere in the United States, right? Especially if you come from a medical background and you have done this work, you are way, way, way ahead to start your medical device innovation process. Like, medical device innovation is a long-term process. It's 4 or 5 years into the future, and you need to plan to those 4 and 5 years. So this 4-month program, it's a launch pad. You can think of it as a launch pad. You will do the first 1 year, 2 years of a normal innovation process. You would do it in this 4 months. So you would have, so basically the value proposition is, in an accelerated rate, you would have the best in class, best in the world process to have the highest success chance at a medical device innovation. So that is a result. We don't want to promise that you're going to end up with a business or that you're going to end up with an approval or whatever. That's way long term. That's not feasible within this time frame, right? So this is the first entry way. Now, again, also being honest, it is a very intensive program. You will be doing a lot of work, and especially a lot of hats that you will be working on. You will be doing research. You will be doing journalism, like interviewing and observation. You will have a physician hat where you will have to research the medical side, the pathology side of things. You will have an engineering hat where you will need to focus on the technology, a lawyer side where you need to research patents and regulatory. So it is recommended that you enter with a team, a partner, preferably preferably a team of 3 or 4 that you can share these hats with. Because for one person to put all these different hats, the lawyer hat, the researcher hat, the physician hat, it might be too much. So if you're up for it, if you're passionate about your project, if you're passionate about actually doing innovation, then you could do it on your own, but it's preferable to have someone alongside you that you can share the burden with. So again, it's very intensive. So what comes next? As I said, the starting date is September 19th. That day, you will have access to the online platform. If you're very motivated, you could probably run through it in the first week, but it's not recommended to like just skim through the whole material. The most value out of the material is actually participating, putting in the work, and I can guarantee you will feel proud by the end result, how quickly your work will stack up, and you can actually see your medical device building and coming into to life with every research, every interview, with every observation you make. So the first session, the first working session will be that week, and that depends on the participants. Most of last cohort, we found that the best times for everyone was Thursday evenings, like Thursdays, 5:30. We are, this is going to be the follow-up coming through this info session, but it's depending on what day a week this cohort would find best. Wednesdays or Thursdays, usually in the evening after work, is when we found the greater flexibility. Yeah. But that, again, the online component, the online platform is going to be available on September 19th. And with the starting group, we will discuss on the weekly sessions. First, you need to make sure that you submit your application. So we have your information. We have a little bit of what your experience is, a little bit of what your idea is coming in. That's in the Health Innovator website, and I'll make sure to get it to you by the end of this session, after the session. Once you have your application in, and we confirm your participation, the only requirement that we have from the MCA is program agreements, and the program agreement is just basic reporting on your metrics, on your progress throughout the program, and following the program. This means if you gain any funding, just reporting that. If you hire any employees, if you gain any IP protection, if you get awarded, stuff like that. Basic income, basic revenue, or basic expenses. We need to report that programming, those metrics to our grant. So in order for our programs to continue to be free of charge. So that is the only requirement we have on the participants. Again, this is a very intensive program, 18 months. We are looking for people who are committed for that whole process, because we do want people to be committed to their ideas, to their research, to bring in innovation and impact into their environment. So if you have any questions, there's more information in the website down below. Is ncamerica.org/innovation/health innovator. I'll do a follow-up email sending you this information, this presentation, and also the application is there in the website. Now, we have a few minutes more. Do you have any questions? Amy, Jack, Lindsay? Or if you don't want to turn on your mics, you can definitely put them in the chat box. Okay. If not, I would like to ask Amy, Jack, what's your professional background? What do you work and where are you joining us from? Hello, Jack, are you there? Are you able to speak up or type in the chat box? If not, maybe Amy? Okay, then. If you don't have any questions, any other comments, then yeah, that would be it. You can expect from us a follow-up email, and yeah, thank you for joining us right now. Hello? Nancy, Lindsay, my audio is good, huh? Right? Hello, is anybody there? Could anybody speak?
I'm here. Sorry, my earbuds had stopped working.
Oh, okay. Yeah, sorry. Like there was a big silence there, and I wasn't
I
sure.
was trying to get it hooked back up. It was off.
Yeah, sorry. I wasn't sure if I was like got disconnected or something.
I have a question for you.
Sure.
Okay, so is this more if you already have a solid idea on something?
No, we don't require you to have an idea already. So if you do have an idea, it's definitely a starting point.
Okay, okay.
Do you have any idea in mind?
I have had one the last couple of years, but so I'm a nurse. I have been a nurse for 7 years. So there's a lot of things that I see that, could need improvement. So that's what I was asking.
Okay, great. Anything you feel passionate about? Any particular issue or idea?
Well, one, I know this is more like technology based, right? Yeah, so the thing that I had in mind was not technology based, but there's several areas like merging the continuity of care from each different facility.
Okay, cool. So that would be more of a process, you think? Not necessarily technology.
Yeah, well, technology could help improve that process.
Yeah. Great. Awesome. So would you be interested in applying for the Nurse Innovator? Then I think you would. I think if you have many ideas from your environment, especially like a couple of years, a good amount of years as a nurse, that's definitely an experience that we are looking for.
I would. Whenever you say there's the weekly 1 hour sessions, do you know like what days or times those would be scheduled at, or is that still pending?
That's still pending, and that's actually depending on what participants would feel better. Like, and if you would be participating, when would those schedule? When it'd be more convenient for you?
Okay. I guess either earlier during the day or later during the day. I'm also a director of nursing where I'm at.
Okay. Yeah, great to know. Yeah, probably for most of the participants, it will be later, like in the evening after work, such. So yeah.
Yes, to not have interruptions.
Yeah, exactly. Okay, Jack, can you hear us? Are you there? Well, if there's no more questions, then we can close the session. Amy, thank you so much. Jack also will be following up with the information, the specifics on the application form, on what the program agreement would be. Is again just a commitment for reporting on the project, on the work that you'll be doing. That's all. If that's it, then thank you so much for joining.
Thank you.